that from your end?
It's recording.
Um, okay.
I've been doing like a lot of like I should be gone away because basically oh well. Oh, okay. Oh, I am. I got. I make self-care.
I mean, I still want to do my teeth, but I'm not. Kind of. I know the benefits. Well, wait, show like right here.
No matter which you do, you're gonna have to break. Nice to meet you. Yeah.
All right, everyone, let's go ahead and get started this morning, afternoon now, I guess. All right. Hi, Dr. Abubaker. Good morning, everyone. Thank you all for being here. This is our largest in-person group yet for this lecture series. So that's amazing. It's wonderful to see that everyone is so interested and supportive of this topic. So thank you all for being here. My name is Kate Gibson, and I am a student in the School of Nursing. I am pursuing my doctorate as a psychiatric nurse practitioner. Yeah. And I'm also, and I don't recommend this next part, but I'm also concurrently enrolled full-time in the International Program in Addiction Studies held between VCU, the University of Adelaide, Australia, and King's College London. And I really wanted to do that to make me a really well-rounded practitioner, because I do plan to practice exclusively in addiction medicine. So again, not recommended, but it's been a very cool experience. And thank you. I want to thank Dr. Abubakar for first telling me about this program during one of his lecture series last year, and hearing how he was doing that with his position made me think that I might be able to manage this myself. So thank you for that. I really appreciate it. And so today is a really exciting day. Our guest speaker is someone that we all know and love, and I'm very honored that he agreed to speak here today. Also about me, I am an ambassador with the Dr. Lorna Breen Heroes Foundation, and our clicker isn't working, so I'm going to do this manually. There we go. Okay, cool. Thank you. And so it's really exciting to be able to expand some of the work I'm doing with peers, as I am a person in recovery from polysubstance abuse. So a little bit more about me. When I was a nurse working and needing to be in recovery, it was a very terrifying time trying to balance patient care with the really dark situation that I was in. I felt very hopeless. I felt very isolated and alone. And I really wanted to change. I wanted to reach a place of wellness, but I was terrified to do so. I thought I was going to lose my nursing license. I thought I was going to lose my job. I thought I was going to lose my friends and the support of the people that I really needed the most at that time. And that kept me sick for way longer than I needed to be. And what helped me get to a point where I was able to reach a place of recovery and readiness was first kind of being caught by my family and their support through that initially. But then next, another nurse who I knew and really respected shared publicly about how they were in recovery, how they voluntarily enrolled in the Virginia Healthcare Professionals Monitoring Program, and what that experience was like for them, and how that support from the program helped them to be successful. And so being able to ask them questions and hear what their experience was like in the program was really important for me. I was afraid to call and ask those questions. So getting that peer experience was very critical. And then one of the most important things that happened that led me to get on this path with returning to school and maintain my recovery was there was a very important person who I reached out to because I was ready to come back home to Virginia from treatment, where I spent 6 months working on myself and my recovery. And I kind of didn't know what to do next. I knew I wanted to go back to work as a nurse, but I felt alone. I felt ashamed. And I reached out to someone that I knew and trusted. And that person shared with me their experience in recovery. And I had no idea that that was their shared experience as well. So knowing that this person that I really trusted and adored had that same set of difficulties, their experience was different than mine, but it showed me that I could be successful in recovery, and that it was more than just about being clean or sober. It was about being able to like craft and develop this meaningful, purposeful life, interacting with other people. And that really just inspired me to keep going. And then I made that decision to apply to the DNP program here at VCU, also with their support. And so I guess the bottom line is that peer support is critical for success. So I also do want to shamelessly pitch my own doctoral work real quick before we get started. And that is the Hope for Healers initiative. Hopefully you will see these flyers up and in the environment in the critical care tower soon. This is a self-referral flyer containing a secure QR code where if another nurse, physician, pharmacy tech, anyone that has any sort of healthcare license if they're also someone like me who was struggling with substance use disorder, they can scan that QR code and they will be confidentially linked up with a certified peer recovery specialist with the Ramsden Recovery Program, who can then tell them about a wonderful peer recovery group that we already have started on campus for students and other healthcare professionals to get together and talk about what life is like in recovery and to get that one-on-one support if they do have that challenging patient, or maybe they have something else going on in their life that they need support with. But it's just for people who are in recovery and are working in the healthcare professions. And so we want to be able to offer that to the employees of the health of VCU Health. It's not associated with any professional boards. It's not associated with HR. It is purely a peer recovery group. And so we hopefully will have those flyers up and in the environment soon. With that being said, I'm going to move on to our guest speaker. But before I do, I want to take a moment to talk about language. Words really do matter when you talk about patient care, and especially with recovery. People who are recovering from or have a substance use disorder might choose to use language that they're comfortable and familiar with, such as using the word addict or alcoholic to describe themselves. Other people might find that language very derogatory. And so in general, we try to encourage people who do not have a lived experience with recovery to refrain from using that type of language, but you might hear it from someone who does have that experience. So I just wanted to offer that clarification. All right. I also want to thank some key people who helped to make this lecture series possible and who've offered a lot of support in my doctoral work. So we're going to start with Dr. Omar Abubakar, who's helped to launch this idea for this important lecture series. Tom Bannard with Ramsden Recovery. Also, all of my peers with the Ramsden Recovery Program and the MCV Peer Recovery Group. Dr. Deborah Shockey for her amazing support. Karen Landrum with the EAP program. Michaela Blankenship, Caitlin Hanbury also provided some key support for putting today together. Dr. Lyons Hardy and Dr. Margaret Kuhns. And without further ado, I want to introduce our special guest today, Dr. James Tormey. Dr. Tormey, who many of us affectionately know as Barney, has played a pivotal role in the lives of innumerable patients, nurses, and nursing students, whether it was through his work with the rapid response team at VCU Health or his exceptional tenure as a professor at the School of Nursing. Dr. Tormey has mentored, encouraged, and cared for many of us with his expertise as a critical care nurse and his genuine, warm, and personable spirit. Dr. Tormey has personally shown me that there is hope and a bright future in recovery, further inspiring me to pursue my doctorate in nursing practice and become an advocate for my healthcare peers. So ladies and gentlemen, please extend a warm welcome to our honored guest and speaker today, Dr. Barney Tormey.
That was a really, I'm ready to go home now. All right. Let's see if I can figure out how to run this. Actually. Just so I know.
Yeah, you can just use the. Oh, here we go. There
Okay,
you go.
great, thank you.
Mhm.
All right, well, I'm really excited to be here today. This is the first time I've given a talk on this particular subject. It's really near and dear to my heart because when I was much younger, I had a substance use issue. So I kind of wanted to talk to you a little bit today about my journey, but I don't want it to be just about me, okay? I want you guys to help ask questions and bring up anything that you would like to add or ask me about. And we'll just kind of go through this. I'm not quite sure how long this presentation will take, but I do have a few little stories, and people who in here who have had me as a professor know that I like to tell little stories now and then. So let's just talk a little bit about some of the things. I do want to talk to you first about a little bit about my background. So I am an Army veteran. I've been a veteran. I served for 10 years in the field artillery. And then I came here to MCV, before it was called VCU Health Systems, and I've been practicing here for about 30, actually probably more than 30 years, a little bit more than 30 years. And I've worked in all kinds of areas. Medical respiratory ICU is probably where I learned the most of my clinical experience, dealing with all kinds of medical patients with all kinds of conditions. I worked in the ED, worked in cardiology. I managed interventional radiology for a while. And as Kate said, I was on the rapid response team, which I really enjoyed because I had a lot of time working one-on-one with other nurses and physicians and healthcare groups, and it was really a good time. And I developed, with the addition of another physician, I developed an early warning system here at the hospital, which is where nurses sometimes don't see patients deteriorating, the early signs of deterioration. So we have like an AI kind of system that will alert us that, hey, this patient's starting to go downhill even before the nurse sees it. So we actually, with that system, we've actually intervened in patients' lives very early before we had to escalate their care to the ICU, other places like that. I helped present different topics at the last magnet certification with Audrey. Remember that? Yeah. And then I've been teaching here at the School of Nursing on and off, well, really for 4 years, both as an adjunct instructor and then also as teaching different classes in the med-surg area.
Sorry, you kind of stay with there. People not seeing through your block.
Oh, sorry. Better. Okay. All right. I like to wander around. All right. So there's another side of me that people don't really know. And that is that when I was much younger, I really battled addiction and I had alcohol. That was a substance that I used. And I had to completely change my life in order to become clean and sober and stay that way. So so when I started out, I was sort of in a culture where drinking was accepted. I went to a military college. I went to the Citadel in South Carolina. And anyone who knows about military colleges knows that they're on you all the time. And sometimes on the weekends, they let you out and then you go get blasted and then you come back, right? So that's kind of where that really started. And then in the Army, especially with the officers, they have the officers club and you go there and they have like 50-cent beers and all that stuff. So continuing to drink. Now I developed a whole culture of friends that like to go out and drink with me. So this is like when I was 21, 22, that was back in the dark ages. So I started to develop this culture. And as I went along, I decided that I had to decide to alter my life and alter my life's choices so that I could become clean and stay that way. And that can be very, very painful. Let me tell you how painful that can be. You have to get rid of your friends that you are close to, friends that you have had relationships with. You sometimes have to get rid of your spouse, okay? Sometimes you have to get rid of going to all the places that you are so you don't trigger that addiction. And that kind of helps set up for you to be success. My wife used to say there were two things that she remembered me saying when I was getting clean. And one was I did not know how much I was drinking at the time. And the second was that when I had an intervention, I was mad at everybody. I was really, really mad that people had to come around this table and sit with me and say, you drink too much, you're not yourself, you do stupid things, all these kinds of things. And that showed that I had no insight into my addiction. It was really the start of my growing. So after I actually stopped drinking, I started to grow. So one thing I can tell you is that when you are addicted to substances like this, you stop growing physically, you stop growing mentally, you stop growing socially. And I know those of you that have worked with people who are in the hospital that have substance abuse issues, they're like 30 and they act like they're 12. You're like, he's acting like he's 12 years old. It's because that's his age mentally because he has this substance abuse issue. Does that make sense? They don't grow until they get out of that addiction and then they start to grow back again. So it's very common. And it was the same thing with me also. Okay. So I had to stop going to places. I had to stop going to places like bars and clubs and all those kinds of things to keep me from slipping back into my addiction process. Okay. So I actually outgrew my wife because she was a co-enabler. I finally got divorced And then because of all of those things I did together, I've been sober for 40 plus years. No drinking. Thank you. And it's a daily struggle. Okay, it's a daily struggle. But I was telling Kate, the longer you get away from that last day of addiction, it does get easier. But at first, it takes a long time to get over that. You know, when you smoke and like you have that craving for nicotine, when you finally put the cigarettes down, that craving for my substance, which is alcohol, it took 5 years for me to get over that. Okay, so it takes a long time and it takes a lot of people to help you and a lot of things in place so that you become successful in doing that. Does that make sense? Okay. Okay, so in retrospect, why is it that we do the things that we do? And in this case, oh, sorry, I need. Okay. And why do we do these things to perpetuate addiction? So basically to satisfy basic drives, first of all, like hunger, belonging, all of these kinds of things to help satisfy that. The second thing is to bring us pleasure, mental pleasure, physical pleasure, whatever it is that helps bring that along. In some cases, we're compelled to do it by society, by your friends, by the places that you are. You're in a culture where things are acceptable that maybe aren't acceptable in the general public because your little group or peer group likes to do it. You become compelled to do it. Sometimes because you do it because of you do not want to have you have bad consequences or unpleasant consequences. And then finally, sometimes your behavior is driven by a combination of all those kinds of things. So those are sorts of different kinds of reasons why you have certain kinds of behavior. And once you understand that behavior, that's when you can kind of sort of drill in on why you're having this particular substance issue. Okay. All right. So I didn't want to make a bunch of slides, guys, that just talked about all the physiological stuff behind addiction. So I've got a bunch of stories, but I did want to tell you just a little bit so we're all on the same sheet of music, what really addiction is. So addiction is engaging in continuous compulsive behavior, even to the extent where you know that it's going to do harm to you. Okay. Even though it's going to do harm to you, even though it's going to do harm to your family, you still do it anyway, just because it's an addiction. Okay. So the behavior is reinforced by rewards and pleasure. So this is true really in the beginning of addiction, but it's not really true as your addiction process moves on. Okay, it starts that way. You start to go out and crazy and be with friends and do this and it feels good. But then slowly as addiction takes over, that all changes. And so the last is the loss of control and limiting behavior. So a good example of that, of the reinforcing thing is, so you guys know Chuck E. Cheese? Everybody at Chuck E. Cheese. So what happens when your kids go to Chuck E. Cheese? What do they want to do? They want to play games, right? So you give them some money, they can put it in there, and they get like 10,000 tickets, right? Those little paper tickets. And then they want more money because they want more tickets. And then at the end, after you spend like $50, you turn in 10,000 tickets and you get a 10-cent like spider ring or something like that, right? Well, for them, that's like reinforcing behavior. And actually, that's what happens as you gamble or as you have addiction. It's reinforcing a certain kind of behavior and you continue to do it because it rewards you in this pleasure. Okay, so don't take your kids to Chuck E. Cheese. Plus they can get sick from all those balls and stuff and all that. Okay. Okay, so couple things about controlling limiting behavior. So I remember one time when I was at the Citadel, there was this dive bar down the street called Big John's. And I remember going into Big John's with my cadet friends. We would sit around the table, we drink like who knows how much, just too much. And I was getting up to leave and, oh, sorry, keep walking away. And I was getting ready to leave. And as I was walking out the door, a friend came up and had his girlfriend and somebody else there, and he was introducing him. So he goes, "Hey, Barney, here's so and so," and I shook hands. "Hey, how's it going?" And then I blinked, and then when I unblinked, they were gone, and I was still standing there. I was like, "What happened? Did they get teleported somewhere?" that was really bizarre, right? And so that was one thing, and I, to this day, I have no idea what was going on with that, except for I was probably like, you know, just standing there. So the second one, loss of control, is when I went to this party. Who of you guys are from the South? Oh, sorry. Who you guys are from the South? What is PJ? We don't know. See, it's only for alcoholics that know that. So PJ is this drink. It's like the drink from hell. It's called, PJ stands for Purple Jesus. And it's like this concoction of alcohol. Like, I don't even know what it is. But, you know, they put it, it's like moonshine or something even. They put in these bottles and they're like, oh, we brought PJ. And so, of course, me saying, oh, well, you know, I'd love some of that. So I would drink that. And this party was put on by another cadet friend of mine who was alumni at this time. He gave it to me, and then I really don't remember much, but I do remember the next day I met him and he went like this. I go, hey, and he was like, kind of walked away from me, right? And everybody I knew that at that party did not talk to me. I have no idea what happened. I have no idea at all. And it was really, really scary to me to know, well, what happened to that party? What did I do? Because I don't remember anything I did. Guess what? I never asked him either. I just did not want to know. No. So loss of control and behavior, really, two really scary things that happen a lot of times when you're having substance abuse issues. Okay. So people can be addicted to anything. You guys have seen that show, My Strange Addiction? Like girls eat like foam out of cushions and seats and stuff, and they eat paint and they do all kinds of weird things, right? So, but people can be addicted to anything. You can be addicted to gambling. You can be addicted to porn. You can be addicted to whatever. Some guy on that show wanted to marry a doll, like, you know, one of those inflatable dolls. Like, it's crazy. So you can really be addicted to anything. And most oftentimes it's a chemical substance, but on occasion it can be other kinds of things. And when you get rid of that addiction, when you finally break that addiction, it's not uncommon for you to become addicted to something else, right? So like when I stopped drinking, the first thing I did was I started to build computers. Like I like building computers. So I have like 10 of them in my garage and they all work and I've never been on any of them, right? My wife tells me to sell them, but I can't get rid of them. They're like part of me. So, so an addiction is you have the inability to stop regardless of the consequences behind it, okay? All right. All right. Another big thing is hoarding. So people who are addicted a lot of times hoard their whatever their substance is, if they can get it. Like for me, when I was drinking, it would not be unheard of that I would have a case of beer in the bathtub, right? Just as a reserve, just in case I needed it. And it's also uncommon for regular people or people who are not addicted to think one way, like, where am I going to get my drinks tonight? And someone who is truly an alcoholic say, where am I going to get my drinks next week? Because they've already figured out what they're going to do for tonight and tomorrow and the next night and the next night. But next week's going to be a problem, so I need to start thinking about that. Okay, it's a real different mindset of thinking. So just in an addiction process, these are the things that you have to grapple with in order to become successful and beating your, excuse me, in beating your addiction. All right. So everybody's heard this word tolerance. It's a marked increase in use of substance to achieve the same effect. When I was drinking heavily, I never felt it. I never had a hangover. I could always talk. That blackout thing kind of got me though, you know, when I blinked my eyes and they went away. But other than that, I didn't have the normal kind of things that people had when they drank. And I would say, well, I'm German. Germans drink beer, you know, it's part of what we do. Until the counselor told me, well, they're allowed Germans who are alcoholics. And then they kind of took that one away, right? Okay. So tolerance also occurs when an organism doesn't respond anymore to the same amount of the substances they use. So either they have to increase the dose that they use or change to a more potent type of drug, right? So I started out drinking 2 drinks in the evening to 2 6-packs a night, which is a lot, right? But at the end, I was drinking a case of beer a day, right? And luckily, my liver never sustained any real damage from that, but it sure could have, absolutely. Okay, and again, I would go out and I would never feel drunk. Others would be like, and I would be like, it's a big deal. And that's a true sign of tolerance when you can take that kind of drinking or whatever, and you don't even really feel it, right? Does anybody have any questions so far? I'm really going on and on. Okay. Okay. All right, I talked to you already about the fact that I would go to parties and not remember what happened as time went on. But people would stare at me the next day and I'd be like, oh, I must have done something, but I don't really know. And part of the addiction process is once you've go through sort of the 12-step process, is that you go back and you talk to those people and make amends to them if you can. And if it's too painful, then you go through the process of doing it as much as you can do it, right? Okay, so that's really an important part. And the alcohol amnesic part for me continued in some cases, but I used to run a lot. I was a big athlete. And so I would go and I would run 15 miles. I would come back and I would drink a case of, not 6-pack of beer because I was hurting. That was my excuse, right? Yes, sir.
So you mentioned in an earlier slide that sometimes enabling your habit, but those same things kind of look like, oh, you were fine last night, you had about drinking, oh, no, you get up on. That kind of same.
Exactly. And why would you think something like that might happen? Just to throw that back on you.
They sip of the
Exactly. And so with those kinds of friends that I had, I would do things that otherwise I would not normally do, like go to nightclubs, places like that. I was very much a single person. As far as doing things, I would never on my own go to a nightclub and sit there and drink. That's not my style. When you have all these friends that are enabling you, you go and do those kinds of things, right? So, other questions? Okay. Okay, so dependence is a state of an organism functions normally in the presence of a drug. To the point where the drug has to be in your system in order to be able to function normally. And once that drug is removed, you no longer function normally. Okay, this is a really important issue when it talks about when you have patients who have drug addictions, okay? Because these patients are not seeking drugs to get high. They're not seeking drugs to feel good. They're seeking drugs to maintain normalcy. Does that make sense? They're trying to keep their life on track. And the only way they can do that is by taking whatever substance that they take. All right. So I had a small story of a patient that I took care of in the hospital here, and she was addicted to Ativan and benzodiazepine, and she decided, or she was completely belligerent and would refuse everything and all this kinds of things. And I just need a little of this, and nobody would give it to her. So the doctor came by and I said, look, she won't get a 12 lead. She won't do this. She won't do that. She won't do this. We need to give her something so she will calm down and do the things that she needs to do. And his response was, we're not going to feed her addiction. I was like, we can't do anything with her. And in the hospital, in this setting, we're not going to cure her addiction. Okay, we're not. So we need to find something to give her so she can calm down her life and do the things that she needs to do so we can treat her safely. Okay, so what he gave her like 0.5 or 0.25, like a really small amount of Ativan. Guess what? She became completely compliant, pleasant, did her 12 lead, walked around, went with PT, went with OT, did all of those things. So I'm not saying that you can't stop addiction, but you have to remember that we're not feeding her addiction. We're trying to keep her in a normal state. Okay. And then when it comes to getting rid of those drugs, that's when you go into a substance abuse clinic, and then they do all the things that they need to do to help that withdrawal process. Does that make sense? Okay. Okay, so this is, there were actually several studies that were done on rats where they actually stimulated the pleasure center with little electrodes. Did you guys talk about this in your psych class? You did? So in the Maslow's hierarchy of needs, the very lowest one, the widest one, and the one is food, and then there's like security and all this kinds of stuff. So they gave this rat the choice of either pushing the bar that stimulated his brain so the dopamine receptors they would have that pleasure sense, or eating food. So guess what the rat did once they found out that pushing that bar gave you pleasure? Screw the food, we don't want that anymore. So all he wanted to do was hit it, hit it, hit it, hit it. And this is an animal that most animals thrive on eating to survive. So that just shows you how potent addiction is, right? So this animal that only knows how to eat felt that that pleasure sense was much more important than eating, sleeping, all that stuff. And I think that rat did it until they were dead, right? So really an interesting study, and just goes to show you how difficult it is to once you get abused, the drugs, to get off of them. Okay. All right, so each substance that you treat has a specific withdrawal period, and we use different kinds of scales to measure that. We use CEWA scoring for alcohol. We use COW scoring for obituates. But they're all different, and everyone has sort of a characteristic difference in their withdrawing and their unique experiences and how that happens. So I'm sure you guys have had cases where you've been in with patients who are in withdrawal. They're on CEWA scoring. You give them a little bit of Ativan, and they get through it. Not too much trouble, right? And you have other people, like I had on, I think it was North 5 and North 6, who ended up being in such bad addiction that we had to call the ICU. They had to put them on a ventilator. They had to put them on drips, all kinds of drips, ketamine drips, all kinds of drips. And that patient was in the ICU for almost 20, 25 days out until that addictive process and that withdrawal period was over. Okay. And guess what that person did? Went back out and did the same thing all over again. And that is so hard. It is really so hard. So for me, I didn't have any withdrawal symptoms, but I've seen many people withdrawing from alcohol, and it's not a pretty sight. So I just am thankful that never happened to me. All right, so the cost of substance abuse, and this happens to, quite almost everyone who's in chronic substance abuse. Absenteeism at work, absenteeism at home, low productivity in whatever they're doing, getting all kinds of accidents, falls, or motor vehicle accidents, or bleeding, any kinds of things like that could happen. Wait a second. Lost my place. Okay. And you're in the hospital a lot of times, so you have high medical costs. Some medical costs are covered, some medical costs are not, depending on what's going on. One of the things that kept me sober was that I took care of ETOH cirrhotic patients, right? So I would spend my entire shift giving blood products to those patients, and finally they would die. And it didn't take long before I realized that this is not the way I want to go, right? So that sometimes you have your own ways of seeing exactly what's going to happen at the end point. And that's what happened to me. And that's what really drove it home, that I just was not interested in doing this anymore. Okay. Loss of job, loss of income, loss of friends, particularly your close friends, people that you were with for a long time. They no longer want to hang around you, because as you drink and as you use substance abuse, guess what? All your social boundaries just go away, right? You no longer have like filters. You no longer have cues. You start doing dumb things. You start getting in fights. Your friends are like, I'm not going around him anymore. And then lastly on this slide is that you're known a lot by police, right? Because you had accidents or you got in fights and they came and they arrested you. And so your name gets to be pretty well known amongst the local police department. Okay, so here's the big question. What does it take to become clean, right? I've been clean for a long time, really long time, but my path is not like your path or your friend's path or other paths of people that you know, right? Everyone has a different journey to go to become clean. Either you hit rock bottom, like really hit rock bottom. You get in a car accident, you lose your family, they're all killed in the accident, and maybe that's your rock bottom, or maybe not so much. Maybe you went to a party and all this stuff, you're like, ooh, guess what you did? And you're like, oh, that's so embarrassing. I'll never do that again. So it all depends for different people. I told you my awakening moment was in the MRICU. That was like the end. That was like, I had not drank then, but that really put the nail in the coffin. I was not going to anymore after I saw that. Okay. So you divorce yourself from your friends, from the environments that help support your addiction. I told you it took me like 5 years to become like not craving anything, but I still do not let people bring beer to my house. None, zero. You cannot. And if we go to the beach and we go with families, you may not bring beer to the beach or I will not be there. I won't drink it, but I'm not going to do it. I'm not going to tempt myself. Okay. I can go out with my wife. She can have dinner. She can have wine. No problem. You do not bring beer to my house. That's asking for trouble for me. Okay. And like I said, once you stop your addiction, you begin to grow again. And you grow pretty quickly. So I stopped drinking. I started going back to school, got my RN, worked here for many years, did lots of things. I grew as a person. Guess what? So my wife was a co-enabler. She did not grow. So guess what happened? We went like this. And it was sad and it was unfortunate, but I mean, that's life. I mean, what are you gonna do? I couldn't do anything about that. Since then I got remarried. A lot of you know my wife. She works over here also. Best decision I ever made. Okay. Okay. So you have to make these hard decisions as you grow, right? And it's not pleasant. It's not easy. And it's a decision that you have to make by yourself. You have to decide for yourself. If it's a coworker or a friend or someone else, you can help them, but the decision is really up to them. And in addiction, a lot of times you fall right back into it. Even after all that stuff happened, you still go back to it. It's really, really hard, right? So one day at a time, keep yourself together, realize there's a great end, but it takes a lot of work and you can do it. You can help your friends. Anything you can do to help your friend understand and work. If they fall back, you've seen it all. We've seen it a bunch of times, right? People come back in, come back in, come back in. Sometimes it's really hard. And sometimes people don't make it. They don't. But you got to give them the opportunity to try. Okay. Join support groups, AA, Al-Anon, what's some of the other ones? NA, oh yeah, I don't like this. EA. Okay, so there's lots there. I went to some of those groups. Sometimes they would stand up like I'm doing and talk about things, and I would think like, oh man, that's like something that I did or something that I can relate to. Other ones I went to and everybody was smoking. I was like, I'm not going. So yeah, it just depends on where you go. You have to realize that your addictive behavior is going to hang on to you for a while. My wife constantly, the wife I have now, constantly tells me, you're speaking with your addictive brain. Like you confabulate things and you start to like make things up, and it's just the way things happen. And so you have to remember that addictive process and behaviors are going to keep on for a while, even after you stop drinking, right? And then you have to find friends like Kate and you guys who are supportive of your journey. This is just the way I teach. Okay, so you have to find a group of people that will be supportive and support you in your journey, because you can have friends that are friends, but they don't understand your journey, right? You have to have people that understand where you're going and maybe have gone through that journey themselves, because those guys are going to be effective in keeping you alive and keeping you safe and all those things that you do. Okay. All right. So you have to also need to know when you need help, when you have that little sensation where, oh man, a drink would be great right now. You know, I feel like I don't know if I can take it. You can call, like, throw a line out there, get your friend on the line, have your friend say, come over and sit down. We'll talk about this. We'll come up with strategies, right? So like I said, it took me about 5 years to do the craving, but everyone's different, right? Everybody's different. And everyone needs to have a good support system like this group and this program to help you guys along, to make sure that you guys stay sober. Okay, so life is worth living. And once you become sober and stay that way, you will see how wonderful it really is. And everybody can say that, but it's your journey. It's your friend's journey. It's your someone you know's journey, whoever it happens to be. That's my message. Any questions? Yes. Yes, sir.
So, how many journey?
Oh, after. I was already sober when I started, got my nursing. When I started working here, I'd already had maybe 5 years in the recovery.
I was gonna ask you, as a nurse, healthcare provider, there's temptation to set up post-addiction, which is what one substance to the other, on a daily basis. And I'm gonna ask you how to manage that. That's probably the hardest one. I say for us, in the healthcare business, it's probably the hardest journey, or made harder by temptation, daily temptation and stuff. Just switch from one substance to the other.
It's unbelievable. And I was speaking more specifically about if you're off substances, to go to something completely different, like all of a sudden become a marathon runner, like, and you just run until your legs drop off.
Mhm.
But it's been known though, switch from alcohol to opiate, from opiate to surprise.
Right, exactly.
You have family history.
So I'm adopted from Germany, German straight beer, right? But this is such a long story. So I actually didn't know who my family was. So my wife said, why don't you go and do ancestry.com and swab your, thing and put your DNA in. I have a family in South Carolina. And I have a brother and a sister that I never knew. And South Carolina. And my father died of alcoholism, right? When he was 50. So that shows you, before that, I knew nothing, right? I was adopted from Germany and moved here, so.
Well, that proves the twins studies that shows that take twins, you have them live in two different environments and they end up both,
Yep. And I've been having some trouble with my blood sugar. So I also asked my brother, did anybody in our family have diabetes? He goes, well, no, except for your grandpa lost his leg and then a toe on the other foot.
There it is.
I was like,
There it is. Yeah.
all right, yes, sir.
You're obviously very open about your recovery now. In
Mhm.
terms of your earlier career as a nurse, how did you navigate? So you're open about your recovery now. In terms of your early career, how did you navigate like disclosure with your colleagues and in other settings around your recovery?
So this is, like I said, this is the really first opportunity I've had to talk about this. So I haven't really been open per se. But I've become more comfortable in talking about addiction after I've been away from it for so long. And with everyone who is addicted, there's plenty of moments that nobody's proud of, right? You're not proud of, but I feel like even talking about those, and I say that because there were a couple of nurses in my environment who are in recovery, and they would come to me and ask me, and I would talk about the struggles that I had and some of these things that I've been talking about. And it helped them to understand why they were feeling the way they did and what they could do to help themselves out. And even if it's one small thing, I feel like it's important they know. I can't give them all the answers, but I'll tell them what I know specifically for my journey. Yes, sir. Good to see you.
Thank you for your honesty.
I remember you mentioned that you didn't drink during one of our lectures. I don't remember what it was related to, but I was like, I want to know more about that because
Whatever you think you want.
yeah. I'm sober too. Definitely a huge part of me even being capable of going back to school. But I just finished my rotation in behavioral health because I want to work in detox. And I have realized it is very difficult to look, even with the lived experience, somebody who wants to leave AMA to secure their drug of choice or whatever it be. escape the discomfort they're experiencing. I've wondered if it's the best use of my time because I hear like psych is everywhere. I don't know if you have any professional advice in that arena because I feel like I'm there just monitoring safety. It's really difficult to like connect with people in the acute setting. So I don't know.
So I'm not quite sure I know what your question is.
Like, did you ever think about working in behavioral health? Were you like, no, I had enough of that in my own life. I'm gonna work in the ICU.
You know, I'm a ICU kind of person, right? So it's just what I'm used to doing, and I love doing critical care. So that's what I'm used to, but it's very painful when you know that a person's leaving AMA just because they want to go back out and use again,
Mhm.
right? And no matter what you say, they don't care one bit. They're just gonna go, right? So you just have to let it go.
Yeah.
You know, you can try, but if they're not ready to hear your message, they're just gonna go back. Because guess what? Sorry, I didn't interrupt.
No,
But
you're good.
guess what we're not talking about going back and having a party. We're
No.
talking about going back so that they can become normal to
Mm.
themselves again.
Yeah.
And they can't stay in the hospital because unfortunately, in a lot of cases, the hospital doesn't provide them the normalcy they need so that they feel more comfortable in the setting.
Yeah, I mean, I got to give to when somebody was refused the benzos during treatment team and they acted out so they could get the B-52. And as someone in recovery administering that shot, I was like, I feel like I am in a way able to behavior. So it's this very tricky thing.
It is. It is.
And I'll speak on that real quick because I currently work in an ER and I see a lot of that behavior as well. And it can be tough as someone who's in recovery myself. I know that that person is just trying to get back to their sense of normal so that they can participate in their care and so that they're not in agony. But it can also be hard sometimes because you don't want to see that person fail. So I think how we can bridge that gap is by knowing what resources we do have available to us for these people struggling with substance use disorders. So if you work at VCU, one of the great things is that we have a inpatient addiction medicine consult team that we can call for those folks that come into the ER that are maybe in like the PACU and you're like, hey, why isn't all this Dilaudid I'm giving this patient helping their pain? And then the more you talk to your patients and you realize that maybe they're having some symptoms of a substance use disorder, you can offer that addiction medicine consult to them and they will come and see them. And then there's also the Motivate Clinic, which is the outpatient part of that addiction medicine team, which we can offer patients as well. And so sometimes we might not be able to reach them or really help them in that moment, but we can kind of look to those outside resources and offer that to people. And unfortunately, the other fact of life is that not everybody's ready for change yet. And we have to like respect that. And that's really hard, especially as someone in recovery where you're like, I want you to have what I have too. I want you to have this relief and find joy in life. You can sometimes I disclose that I'm in recovery to my patients if they seem really motivated and maybe they're feeling kind of down, but you can offer them the support and your best wishes and offer them resources. And it can be really hard because you don't want to see people struggle, but sometimes that struggle is what people need to find that readiness for change. And so I hear you, I see you. It can be really hard.
I can't stop without telling you one more story, okay? So I told this to Kate earlier. So my wife, and this is, we're talking sort of about what you had, I had a coworker who came in and wasn't like thinking like she should and wasn't acting like she should. And my wife was actually CC at the time and said, and Brooke brought her into the room and said, what's going on? Is everything okay? And the more she talked, the more she was like suspicious that something was going on. And she said, oh, and the coworker was pregnant. And so she said, go get your purse. We're gonna look at your purse. Like, I don't know if you can do that today. She probably would be fired, my wife. for doing that. And so she made her come in and dump her purse out, look through it, and goes, okay, now we're gonna go to your car and we're gonna look in your car. She was a badass, let me tell you. So she went to the car and in fact, yeah, there was some substance there, substance use stuff there. And she said, okay, you're gonna give me a report on your patients. You're gonna go home. We're gonna talk about this at another time. And got her involved in some of these programs. And you would think that she would harbor all this resentment. To this day, she says, my wife helped save her from addiction. right? And she became cleaner. So sometimes it's painful to begin with, but in the end, it's like, that's the jolt they need. Can I tell you when that is? I don't know. I don't think I would have done that, but you know, she just did. So it just depends on when the person's time is ready. And if you're there, you can give support, or you can like call it out and say, you're BSing me, right? And then hopefully that's the jolt they need to get them on the right road. It's tricky, right? Okay. Other questions? Yes, sir.
This is not necessarily directly related to you, but I was giving a seminar to graduating class from nursing school, maybe about 4 or 5 years ago. And when we're done, they were very thankful. And I said, they're just about to graduate. This is maybe May, or I said, has anybody talked to you about addiction before? Said, no, nobody said a word to us about addiction. I said, have they talked to you about diabetes? All the time. Have any talk about hypertension? All the time. And my question is this: what it would take for us, in, you know, not only in nursing, but clearly you're here teaching, and you hopefully have some strength into the curriculum, and dental school and medical school, we're as vulnerable to addiction as the general public, maybe sometimes higher, and nurses and dentistry especially. What would it take to bring this stuff in the curriculum, not only to save our patient, but to save ourselves? You know, I was just writing a chapter and said, the knowledge in textbooks about addictions, textbooks that taught in medical school and dental school and nursing school is about 50 years old. And, you know, there's a lot of science that had come out. We could start teaching that science. What would it take to bring that into the curriculum, the stuff that you talked about today? I mean, I'm sure the slide that you gave, a lot of, you know, science about addictions, that nursing class, you know, I tried to do my part in dental school, but nursing school, the nurses are vulnerable, maybe sometimes more vulnerable. What would it take to bring that into the curriculum?
I think that would be an important aspect to talk about. We talk about pain, talk about death. This would be another area that I think would be really important, at least to give them some, you know, awareness of.
What would it take, though?
Like these administrators to put it in the curriculum. I'm happy to talk about it. I'm happy to you know, share my experiences with it. But you know,
Well, you're a power, though. You're a power. You're more than just a professor or a nurse. You're a power into this field, you know?
thank you, I appreciate it. But you know, I had a coworker who was almost through anesthesia school, and she was controversial. She paid for the whole anesthesia school, and they booted her out. That's a huge, like, that's a huge thing. Yes, ma'am.
Because nursing curriculum is packed full, just like any other healthcare professional curriculum, but it is covered in our undergraduate mental health course. And I would dare say, Lyons is sitting here, I would dare say it is in the graduate as well. But certainly we could do better with talking about it in our profession and how we have more access than anyone with some substances. So there's always room for improvement in our curriculum, as we have just overhauled all of it. So.
Picks. I said, what are you going to do it? I mean, where are you going to put it? There's no room in the. I said, take out stuff that doesn't kill people and talk about stuff that kills people, which addictions and opioid. And I think, I don't think personally we should wait until the graduate. Medical students ask me to come and talk to them at lunchtime. This is the first year and second year medical students. And I said, don't you have this stuff? And they said, oh, they told us, again, medical school, and I don't know if there are any physicians here, medical school said, well, you get it when you do your psych rotations. You get about addictions, about pain management. And said, we talked to our upperclassmen, and when we talked to them, they said, oh, by the time you get to the psych rotation, you're already tainted. You can't change your mind. It's really at the level of basic sciences where addiction needs to go and where it belongs. Because once we go into the school and you have encountered, God knows, with one or two people in the emergency room who are seeking medications for other reasons, you have this opinion that addictions is a moral issue. These are corrupt, these are prisoners, so I think it's almost like the first semester we should talk about addiction. When we talk about anatomy and neuroscience, I belong to a neuroscience advocacy group, and they now fighting to bring the science and neuroscience, their whole, sorry, I don't take, but I mean, let's put it in. Waited too long. I think people should know about it. And thank you for being here. I'm not in recovery. I'm grateful, more than proud that not to be in recovery, because I'm grateful for my genes and circumstances. But I lost my son to the addictions, and that's why I got involved. Yeah, so anyway.
Thank you so much. All right, thanks, everybody.
Dr.
Oh, we
Abubakar.
have a question.
Yeah, I think we had a few more questions.
Oh,
There's one in the back, and I will say, as I'm walking towards the back, we are looking at engaging with the nurse residency program at VCU to also offer some of these supports and guidance to nurses as they enter their own practice.
Thank you. I raised my hand just to say we actually did not cover addiction in our mental health course. It was skipped because we ran out of time. We talked forever about personality disorders. Yeah. Which is probably the most important topic that we could cover in mental health, and we did not cover it at all.
Got some here. I've got some here, a little bit.
Hi, what I'm thinking about in the curriculum, I just had a meeting with another group yesterday about this. We spend so much time teaching students what they need, what we think they need to know. We don't spend a lot of time teaching students about who they need to be. And it's that piece that is, to me, is part of this, because this is not just curriculum content. This is, how do you handle stress? How do you go through life? What supports are there? There's a lot more than just memorizing specific pieces and things they need to know. We're really trying to create humans that can survive these professions that we teach in.
Thank you very much. Everyone's questions have been wonderful and amazing. We really appreciate your engagement and time today. We are going to go ahead and move out here. We've got some box lunches. We've got like 30 box lunches, so maybe not enough for everybody. I also brought some sweet treats to share if people want to engage in conversation or ask myself or Dr. Tormey any questions. Thank you so much for your time today. We also have a lot of literature here and pamphlets on peer recovery, on resources for healthcare professionals in recovery. And I also want to point out the Virginia Safe Haven program. This is something I needed years ago when I was trying to get into treatment in a place of being sober. And so it is a way outside of your healthcare programs, outside of your employer, that you can get very, very confidential help, including therapy, peer support for people who are seeking treatment for substance use disorders, and it's sponsored by the Medical Society of Virginia. So very cool program. We're grateful for them, and thank you all for being here today.
So I don't know if you guys have these or not. My friend works for Sarah of Virginia.
Yeah.
And she actually runs the.
Yeah.
And these are resources.
Oh yeah, this is awesome. I hand them out in the ER working all the time.
Not.
And you know what?
Because I can get this.
Students in here.
I mean,
Is it okay?
it is.
It's very comprehensive. It's in your pocket.
It's great. It fits.